I'm super excited to introduce this next segment, as I think it really does relate very well to the previous session as we continue our discussion on the importance of treating neurological symptoms of Kabuki syndrome and the desire to know more about supports outside of drug interventions. In this segment, we will hear from Dr. Rowena Eng, who is a pediatric neurologist from Kennedy Krieger. She will be discussing the research and clinical utility of neuropsych evaluations. Neuropsych evaluations are a great tool to better understand your child's cognitive strengths and challenges, as they highlight areas of struggle as well around multiple learning domains. At this point, I'd like to welcome Dr. Eng.
Thank you for having me here today. I'm a pediatric neuropsychologist over at Kennedy Krieger Institute and assistant professor over at Hopkins University School of Medicine. I do work alongside clinically with Dr. Harris and seeing some of the patients with Kabuki syndrome. So I'm really happy today to talk about the clinical and research utility and thinking about neuropsychological evaluations and how it can play for clinical care, but also in research settings. Today, I'm going to be talking first about kind of like what's the purpose and benefit of using having a neuropsychological assessment. What are some common referral questions or utilities for an assessment? What's involved in an assessment, and then thinking about what can we use neuropsychological assessment for in terms of both clinical research and treatment planning. So, what is a neuropsychological assessment? So there are many different types of assessments. There's speech language evaluations, occupational assessments. Some people have gone through psychological assessments, and then there's a neuropsychological assessments. And so clinical neuropsychology is really a specific field in clinical psychology, broader field, where it's really dedicated to understanding the relationship between brain and behavior. So it helps us think about like how those are related, and we apply that when we think about diagnoses for brain disorders, assessing brain and also kind of cognitive functioning. And that's what we kind of also use in thinking about more specific treatment planning. As you might see, like some of the neuropsychological evaluations use a lot of tools that might overlap with speech assessments, occupational assessments, and psychological assessments. But what sets apart for clinical neuropsychological evaluations are the understanding of how our brain is impacted when we interpret the data. So how do we use that same set of data to really tell us what are clues going on in brain development and brain function? There are different types of neuropsychological assessments. There's screening, focused assessments, forensic, and more commonly when we work with clinical populations or rare diseases for diagnostic assessments, progress evaluations, and rehabilitation purposes. Screening or consultation evaluations are typically when you meet with a neuropsychologist to see if an evaluation is even useful. So it might require looking at past records, current school records, medical records, to look at whether or not treatment or something else would be helpful first before doing an evaluation. So for example, if there was significant change in behavioral functioning, concerns for decompensation in terms of like a decline in cognition, but also paired with a lot of mental health concerns, we might think about treatment for the behavioral mental health concerns first, because the data we get from cognitive testing might not make a good representation of the skills. Focused assessment is if there's very targeted questions, for example, a learning disability, ADHD, etc. And so you may not get as much testing because it's really dedicated to looking, answering specific questions. Forensic evaluations, more specifically in legal context. So if you're going to, if there's a question of whether or not, for example, something's related to head injury, some outcomes changes is because of a head injury or an accident. Those are more what we think of as forensic evaluations. But for a lot of rare diseases, we think about more diagnostic assessments, progress evaluations, and rehabilitation assessments. So diagnostic assessments is thinking about if you meet a developmental disorder diagnosis. Progress evaluation is to look at monitor your changes in functioning and progress in functioning in response to different treatments. So thinking about academic interventions, speech, occupational interventions, etc., or medication as well, medication treatments, for example, for seizures. Rehabilitation and treatment assessment is when we do an assessment to help you figure out what's a targeted goal. So for someone who might be going through, for example, cognitive remediation or cognitive remediation programs, this is like, for example, someone with head injury, they might think about what are specific, small, achievable goals that we want to target in treatment. And last, neuropsychological assessments can be used to guide research. So neuropsychologist assessments give you a very kind of broad idea of what cognitive functions look at, and you get these kind of snapshots across all these different functions. Then using that kind of snapshot, we're able to kind of think about what are targeted questions, next steps that we want to ask. Benefits of a neuropsychological assessments. So while neuropsychological psychologists may use different tests that overlaps with other assessments, again, what really sets it apart is about how we make inferences about brain functioning. Neuropsychological assessments can oftentimes also examine dysfunction in the brain before you may necessarily see structural anomalies. So, for example, someone who might have hydrocephalus might start to show small changes in cognition, like psychomotor speed or processing speed, before you might not start to see some of the changes in the brain itself structurally. It allows you to look at one person's
I'm
performance.
so sorry to interrupt, Dr. Ang. It just came to my attention that we can't, your slides have not been progressing, but thank you. Please continue.
So where it was kind of going through was like, also neuropsychological testing was really important, especially for rare diseases. It's like really thinking about allows you to look at your own individual performance with other people with similar medical backgrounds and demographic backgrounds like age, education. But it also, what's important is looking at it allows you to track your performance relative to yourself. And this is particularly important for rare diseases because we don't, we're a lot of the research is kind of emerging. So we don't really know too much about some of the areas, and especially in different kind of syndromes yet. And so really it's important to kind of think about tracking cognitive function over time, because all across different cognitive functions, they may also develop at different rates. Okay. It also allows us to have more personalized interventions, treatment and vocational planning, and academic programming. So rather than having like a specific IEP kind of plan and make it fit for your child, really kind of thinking about what does your child need and kind of what specific accommodations that would be uniquely helpful for your child. Because again, even with the same syndrome, there's going to be variability. Every child with Kabuki syndrome might not necessarily fit exactly the same pattern. Okay. And so some domains that we assess includes intellectual functioning, language, visual processing skills, or nonverbal reasoning skills, motor-based skills, so like things like handwriting, attention. Executive functioning is like planning, organization, impulse control, learning, and memory. And sometimes for evaluations, we do academic skills. So they're thinking about screening for academic performance or progress. Some areas that some neuropsychologists would look at, but not all of them, is like kind of thinking about also social cognition, thinking about how you reason and think about interactions interpersonally. And one big area, especially when we think about individuals with developmental delays or intellectual disability as they move on to adulthood, we think about adaptive functioning. So how is this person, a child who's going to moving into adulthood, how does the life skills look at? Can we kind of simulate some of those skills, and how can we think about their comprehension skills and their ability to use some of these kind of functional academic skills in day-to-day settings? Again, some common referral types includes thinking about whether or not your child meets kind of developmental delay versus like a disability, like intellectual disability, any changes in cognitive functioning after an injury, any potential seeming loss of skills that we need to monitor. And more common kind of rule-outs or concerns are ADHD, learning disability, or autism spectrum disorder. Another common question is also thinking about access to services. So things like ABA therapy might require diagnosis of autism disorder. We also look at cognitive functions in relation to medical diagnosis and treatment. So medication. So for example, if you're on ADHD medication, seizure medications, are we seeing improvement in functioning? And then thinking about also transition planning. So again, how can we look at your child and thinking about their kind of sets of strengths and weaknesses, and think about when they move on to adulthood, we're thinking about jobs or vocational planning, semi-independence in terms of like residence or living lifestyle, life skills. Those are all kind of part of a neuropsychological evaluation as we kind of working with children to adulthood. Okay. Neuropsychological evaluations include standardized test measures, usually very thorough interview with the parent, but also might include asking you for lots of different information. So I'm sure like a lot of families who've been involved in assessments might have questions about may have been asked to bring school records from treatment or therapies, And all of these are helpful because it allows us to see things that are beyond just the snapshot in testing, right? So sometimes children might perform better in that one-to-one context with a psychologist, but when you might see that in a day-to-day setting, they significantly have much more difficulty. And so that's all these information is informative for us to understand what specific accommodated child going to like school settings and that we would want to recommend and include in an IP. Um, and I'm just going to skip a few of these here first, but but generally, we also take a very thorough kind of behavioral observations, thinking about how your child's performing in that. Again, it's a snapshot of their functioning. So things like their test environment, fatigue level, medication, or kind of anxiety that day, all those things might impact their performance. So when we think about testing, I always say that it's, we think about the behaviors and watching them test is very informative and not just the score itself, because someone can, for example, get a 0 on a test, no points if they refuse to do a test, if they get the test wrong, or if they don't understand the instructions. All those are different kind of mechanisms to still getting the same score. And so really the clinical observations and that kind of clinical judgment is really important when thinking about diagnostically and also thinking about accommodations. So again, when we think about, for example, behavior observations, just like what I'm showing you here, different syndromes might score something completely, have the same score, but perhaps very different approach. So for example, someone with Williams syndrome and versus Down syndrome, they might show a different kind of pattern of, whereas Williams syndrome might really focus on local details. Someone with Down syndrome might show a little bit more kind of global details. And that, again, they have the same score, but again, if you look at what they draw or how they approach the task, they're very different, and they tell you they process information very differently. Again, lots of information goes into a neuropsychological evaluation, including lots of medical records that we're probably going to ask you, including past evaluations, informant questionnaires, usually including teachers and parents. And then sometimes we even ask for examples of schoolwork so that we know what our parents seeing when they say their child's having difficulties with reading, math, etc. at school. Okay. When we track your performance over time, what we're really looking at is kind of looking at almost like your growth curve. So thinking about just weight or height, we look at how much change over time you're showing. Someone who might not have any kind of medical conditions might be just showing unique, same kind of increments of growth each time. But oftentimes, someone with kind of neurodevelopmental disorders, we see different types of learning. They'll still make gains, but at a different pace. So we might see slightly less gains over time, but it might differ this kind of curve across each function. So for example, someone with visual spatial deficits or visual spatial kind of weaknesses might make smaller gains compared to language, even though they're going through, if you're testing over the 2 years, that kind of change for that specific cognitive functions might be different across each type of function. So that's why we also give quite a large battery, a very comprehensive testing usually. And just kind of last kind of few things I want to note is that neuropsychological testing is just one piece in kind of thinking about clinical trials and kind of thinking about how we kind of raise questions in clinical trials kind of development, or especially in thinking about outcome measures for clinical trials. So when we think about clinical trials and outcome measures, oftentimes we look at natural history, ask parents about kind of what they observe about their children, their child's kind of medical history. But neuropsychological testing provides us a general overview too about more of the cognitive strengths and weaknesses that does not get captured in just the diagnosis of intellectual disability. For example, someone with severe language deficits, someone who's minimally verbal, can still have an intellectual disability diagnosis, whereas there's a child who, like Kabuki syndrome, might have really relatively strong verbal skills, might significantly have challenges in visual spatial skills, and still have this kind of intellectual disability diagnosis. Same diagnosis, but very different presentation. And so neuropsychological testing provides us some early kind of preliminary guidance in getting us a pattern of functioning, so we can kind of start to hone down on specific research questions and tools in that very narrowed area that we notice is being more affected. And this is exactly what some of the Kabuki syndrome researchers have shown us, right? In the past, and in more recent years, Dr. Harris being one part of it, is that, in the past, we've in preliminary studies or case series, they've looked at kind of psychological testing and gotten having clues about this kind of visual spatial area being potentially an area of deficit, which has then been subsequently confirmed in research studies where it's much more controlled with molecularly diagnosed children with Kabuki syndrome. Okay, and so again, neuropsychological testing, when in partnered with the research, we can have like kind of semi-flexible test batteries where it could be used for clinical purposes, but also can collect data, because you're going to have lots more children with the same types of measures that could be then used in kind of thinking about for clinical research questions as well. Okay. And I'm sorry about all the tech issues that happened today, but I'm happy to answer any questions by currently or in email as well. Again, like, thank you for having me here, and happy to answer any questions that families might have.
Great. Thank you so much, Dr. Ng. Apologies again about some of the technical difficulties that we've been experiencing today. So we do have a lot of questions. The first one is, how do these neuropsychological who would perform these neuropsychological assessments? Would a child benefit from an educational assessment by the school psych and then a clinical one?
Yeah, so that's a great question. Like a school psych evaluation is oftentimes different from a clinical evaluation, neuropsych evaluations, because school psych evaluations oftentimes focus on academic testing, right? So sometimes when I kind of put an asterisk about academic testing and neuropsychological evaluations, is because we do screeners for that, but oftentimes our focus is more on cognitive function. So thinking about learning, memory, attention that are not tested through school settings typically. And so, these are these all impact academic functioning, because if we can't remember, you can't learn very well, right? And so so we do a lot more of those kind of cognitive functions, and we do screeners for academic testing, but we don't necessarily focus on educational testing. So I oftentimes recommend families, yes, do clinical evaluations and still do the IEP or the educational testing. Both are going to be important, incredibly important in thinking about kind of academic programming.
Great. And there's a question asking if I go to Kennedy Krieger Institute for research participation, is a neuropsych evaluation included in that?
So Dr. Harris is going, and I think she's not here right now, but she will be doing some, and again, thinking about outcome markers and what we do know so far with Kabuki syndrome, she will be doing some cognitive testing. It might not necessarily be as comprehensive as a neuropsychological testing, because, as someone who comes for neuropsychological testing, they might be here for almost half to all day. It's quite a long test batteries. We have lots of breaks. It's kind of made for your children, right? Like your specific child, and kind of based on your question as well. What are you here for? But it might take several hours, and sometimes we might have them come for 2 days if they can't tolerate in 1 day. And so, I think it's value to, of course, doing cognitive testing for research purposes. We need participants to kind of make movement in clinical trials, right? But clinical assessments is also going to be a lot more incredibly comprehensive typically than what we typically think of necessarily for research evaluations too.
Understood. And are there special tests that should be done specifically for patients who have Kabuki syndrome, since there's an imbalance between verbal ability and executive reasoning?
Yeah, so oftentimes and it takes some expertise, I think, with the neuropsychologist that you see, right? Sometimes some neuropsychologists might not have seen some rare diseases like Kabuki syndrome, and so that they might give more kind of broader battery. But someone who might have seen someone with Kabuki syndrome might know then, hey, these are areas we want to target a little bit more, because we know that they might develop slightly slower in some ways, right? And so we want to start thinking about measuring these more over time and thinking about how we can support these skills better. And so, typically we would include a wide battery for kind of visual, spatial, visual motor, and visual construction skills, because we know those are areas that are potentially more affected in individuals with Kabuki syndrome. But we also include things like verbal skills, because we want to make sure that those areas are also developing at an appropriate pace, even though if they might be less of a concern compared to the visual spatial skills.
Got it. Thank you. How often should someone have a neuropsych evaluation performed?
That's a great question. I recommend in about 2 years. And if not, a lot of families can't make the neuropsych testing might not necessarily be available in terms of because some families might live in areas that might not have a local neuropsychologist. But I often recommend at least minimally before transition periods. So thinking about transitioning between elementary to middle school to high school, these are kind of key periods that each time when you move to a different setting, they're going to have different level of accommodations and services schools offer you. And so those are going to be more incredibly practically helpful for children, thinking about what's necessary and next steps when they move to a different environment.
So that said, at what age would you recommend children beginning or starting to have a neuropsych, especially since it's used primarily with school-age children?
Yeah, and I'm biased, right? Because I typically recommend seeing children as like young to adulthood. But however, that being said, from a practical perspective, I think most families would typically start seeing us like when they're thinking about preschool age to kindergarten age, when they're starting schooling, because they want to get a baseline of entering school and then starting to kind of measure up when you're starting to return, going advancing in school, and kind of seeing what types of supports are specifically needed for your child.
There's a question asking about the difference between who could administer a test like this, specifically developmental pediatricians versus a neuropsychologist who could administer a battery of tests that would evaluate cognition and strengths and challenges in a variety of learning domains.
Right. And so I think the question is that how you're trained to interpret the data, right? So anyone, you can like, train a lab technician to administer like a research, like, a WISC or a Wechsler's test, right? But the problem is that the person who's not really trained to interpret it might get these scores and not really understand how you apply it in a practical setting. So thinking about, for example, your child going to school or a child thinking about going to a job or workplace, how do we kind of think about this in application of real life settings? And so, I think oftentimes developmental pediatricians might do more like kind of screeners, but might not necessarily through an actual neuropsychological test battery. So they might not necessarily do a kind of comprehensive cognitive test battery. And so I rarely see like a developmental pediatrician who would actually give neuropsych testing, usually more developmental screeners to kind of, and then using that to refer out for neuropsychological testing.
Got it. Thank you so much. We do have a few more questions in the chat, but seeing as we're at time, what we'll do is we'll go ahead and download these questions and send them to you, Dr. Ng, and we will certainly follow up with the audience members post-conference. Thank you so much for your time.
Thank you.